Good day, everyone. Welcome to the webinar, Improve Your Bottom Line by Proving How Effective Your Treatment Is. Before we begin the seminar, a few housekeeping details for those of you joining us for the first time. You will be able to hear us, but we won't be able to hear you. That's because we record these webinars so you have access to them later if you need them. However, if you have questions or concerns, you can use the chat room on the left. You don't need to wait until the end for questions. Our presenter will answer as many as she can at the end of the webinar. We will also be sending the PDF of the slides as well as a link to the video webinar after the event. My name is Angie Fiedler-Sutton, and I'm with the Behavioral Health Association of Providers, formerly known as the American Addiction Treatment Association. SAMHSA defined behavioral health as referring to mental/emotional well-being and/or actions that affect wellness. Behavioral health problems include substance use disorders, alcohol and drug addiction, and serious psychological distress, suicide, and mental disorders. The BHAP is a national trade membership association that provides education and advocacy for behavioral healthcare providers and related entities. For more information about us, including a list of all of our membership benefits and our new pricing structure, visit us at our website, www.aata.io. And now, it's my pleasure to introduce our presenter today. Joanna Conti launched VISTA Research Group in 2015 as a result of her daughter's issues with alcoholism and trying to find a treatment program that worked. A serial entrepreneur who had previously started software and consulting companies as well as an international nonprofit, Joanna wanted to help treatment programs effectively determine their success rate. Using her experience as a marketer for Procter & Gamble, Joanna is working to revolutionize the addiction and mental health treatment industries. Joanna, thank you for taking the time to present today. With that, I will hand the webinar over to you.
Thank you very much, Angie. I really appreciate that wonderful introduction. And I really want to thank the American Addiction Treatment Association, or I guess the new name, the Behavioral Health Association of Providers, for the wonderful work they do. I've been very impressed over the years with the extensive information that they provide to their members on various state laws and regulations, and we're really honored to be partnering with the organization. So thank you very much. As Angie mentioned, I'm going to be talking about how you can improve your bottom line by proving how effective your treatment is. I wanted to start by just telling a little bit about how I became interested in the addiction treatment space. I had a daughter who became a hardcore alcoholic, and she was regularly drinking to lethal levels. And she was in and out of treatment programs for 5 or 6 years. And we were regularly put in the position where it was a crisis situation. She had lethal blood alcohol levels, and we had to find treatment immediately for her. And what we were forced to do repeatedly was to decide where to send her for treatment on the basis of a phone call with somebody who sounded nice and said, "Trust me, we're better than the rest." And meanwhile, we were being asked to shell out huge amounts of money, $30,000, $60,000, $25,000, on the basis of absolutely no information other than, hey, we're good. And so fortunately, my daughter is doing fabulously today. She's going to be celebrating 5 years of sobriety later this month, and we've just been tremendously blessed. But when I look back on that time, I thought, why is there no data? Why is there nothing that tells the families that are coming behind us that if they spend $30,000 for the next 30 days for their child's treatment, that their child has a fighting chance to be sober a year down the road? So I started an organization called Conquer Addiction, and the idea was to help other families find the best treatment programs. So we had a search feature where you could search by location or by type of treatment, or, it needed to serve adolescents or what have you. And what was different about Conquer Addiction, and in addition to the fact that we didn't collect leads, let alone do anything else with them, was that the treatment centers that had the best success rates would show up at the top of a search. So the problem was, after we built this, that we could only find 5 treatment programs that were tracking and would give us their outcome, their success rates. And so about 3 years ago, I went to one of the addiction treatment conferences and started talking to treatment centers and saying, why aren't you tracking your outcomes? And what I kept hearing was, we want to, we fully intend to, it's in next year's strategic plan, we don't have a clue how to do it. And I thought, this isn't rocket science. One of the companies I've created in the past was a software company where I taught myself to program and then spent 5 years selling programs that I and other people had developed. And I thought, we can develop a reasonably priced, effective way of measuring the success rates for different treatment programs. So I started this as a side project in 2015. And shortly after I started it, I came across all the data that showed that if you asked patients how they were doing during treatment and provided that information to clinicians in easy to understand fashion, that it would help patients get better faster. So soon thereafter, we launched that service too. So I want to start by talking about the big picture. We all know that the number of drug overdose deaths has been climbing to absolutely incomprehensible levels. In the year ending last September, 67,000 Americans lost their lives due to drug overdose, and that is 4 times higher than it was in 1999. So you would think that, in a situation like this where there's such a tremendous epidemic, that treatment centers that are helping patients recover from addiction would be bursting at the seams, and that they would be very profitable. And yet, this is the type of information that's been coming across in the newspaper lately. And I saw all these treatment centers closing, and I thought, I don't really understand what's going on. And then I received an email from a friend that really brought the message home. A friend of mine, Bernie Schultz, had started Grace's Way Recovery for very similar reasons as I had started Conquer Addiction and Vista Research Group. She had a son who became addicted to drugs, and when she was trying to help him recover, she saw the need for a strong sober living home, and she started one in Florida. She soon started 2 more, and then she started expanding because she saw the need into providing residential treatment and providing detox treatment. And I knew that Bernie was doing this for all the right reasons and was doing everything she could to put the patients first and help them recover. I knew she was offering a high staff-to-patient ratio. She was employing only master-level clinicians, and she had provided the full continuum of care. She understood that there's no substitute for time when you're trying to recover from addiction, and she often kept patients in treatment long after the insurance had stopped paying for them. So I was really upset to hear that she had to close her doors. And I contacted her and I said, why did Grace's Way have to close? And she said the problem boiled down to the fact that she just couldn't get paid predictably. That she would bill for her treatment services, and she never knew what portion of what she billed that they would receive. Sometimes it would be 30%, sometimes it would be 15%, occasionally it'd be 100%, other times it would be 0%. She said we just had no way of figuring out how much we were going to be paid on a month-to-month basis. And then, even after we'd been paid a whole lot less than we expected, oftentimes the payers would come back and they would demand to do a chart review. And then they would decide they had overpaid us and they would claw back previous payments. She said we tried to get in network, but networks were closed. And while payers talked about wanting to pay more for results, there was no mechanism to do so. And she finally, with great regret, felt that she had to close her doors because she just, without predictable payments, she couldn't put together a financial model that made sense. So this is very disturbing. We're hearing from a lot of treatment programs that are in very dire financial condition. So what is the solution? What is the answer? I think the problem really boils down to the fact that payers aren't differentiating a good treatment program from a not so good one. They don't have a way, an easy way to differentiate who's out there is doing really good work and who isn't. And as a result, they're treating addiction treatment as if it's a commodity. And as we all know, the only way a commodity can compete is by dropping its prices. So I believe that the solution is that addiction treatment programs must start measuring their outcomes. They must get over that fear so that they can be paid commensurate with results. So as Angie mentioned, I started VISTA Research Group in 2015. And we now have two types of products that we offer. The first is our Insight line. We have Insight Addiction, Insight Behavioral, and we just launched Insight Detox 2 weeks ago, where we monitor your clients during treatment so that your clinicians can identify those that aren't progressing well and can change clinical care. The second program we offer is Recovery 2020. And this is where we follow up with the clients after they leave treatment to generate independent success rate data. So I'm going to talk about Insight Addiction first. What it does is it identifies and tracks those issues that are directly related to treatment success. We screen and monitor all new patients for depression, anxiety, trauma, and eating disorders. And if they answer any of our screening questions positively, then we take them to a full academically validated scale. And it would be the scales that your clinicians are probably already used to, the PHQ-9 and the GAD-7, that sort of thing. We also monitor the severity of suicidal thoughts and self-harming behaviors. We also monitor the strength and frequency of cravings and how satisfied they are with treatment. Everything we do is online, and how it works is when your clients come into treatment, you would open up our software on an iPad or a laptop, you would click New Client, and then you would hand the iPad to them, and they would give us permission to collect their information and immediately give it back to your clinicians. And then once we have the permission, and if, by the way, if you treat adolescents, we also need a parent's permission. Once we have the permission, then we take clients to a full intake questionnaire where we're looking for baseline information of how they were doing before they began treatment. What is their primary drug of choice? How much were they using? What's their addiction severity? We also ask a number of different quality of life questions. And then this is where we screen for different mental disorders and then take them to a full academically validated scale for any that they answer our screening questions positively. So the intake questionnaire takes about 20 minutes for patients to fill out. By the end of that time, though, we have a tremendous amount of information about your patients. And from that point on, we can get updates where we only ask about those issues we know they're wrestling with. So the updates only take typically 2 to 3 minutes for patients to fill in. So they're not burdensome at all. And then we provide all of this data instantly to your clinicians and management in very easy to understand graphs. There's a lot of research that shows that this process, which is typically referred to as progress monitoring, makes a big difference in helping the hardest to treat patients. Dr. Carlier did a meta-analysis of 45 different mental health-related clinical trials and found that the clients whose clinicians were able to access this information got better faster in 2/3 of the cases, including all 3 of the addiction treatment studies. And I'm sure as a result of this analysis, the Joint Commission made the decision that they wanted all of their accredited behavioral health care organizations to start using progress monitoring. Their new requirement went into effect this January 1st, and it has 3 different requirements. First, You need to be systematically collecting the data using validated instruments. They want it to become directly from the patient about and tell you how they're feeling. Then secondly, you need to be able to show the Joint Commission that you're actually using the data to inform clinical care. And finally, you need to be periodically aggregating the data so that you can determine whether your treatment is becoming more effective over time and how you relate to other similar treatment programs. So we have added in various features to Insight to make it very easy for our clients to comply with the Joint Commission. So I'm going to stop doing the slides here, and I'm going to show you a quick demo of how Insight works.
So this is what your clinician will see when she logs into the Insight software. She'll see a list of all of her patients, and you'll notice that some of them have one or two red flags next to their names. These are patients that in their most recent survey reported some level of dangerous behavior. Perhaps they're having suicidal thoughts, or they're self-harming, or they're reporting using drugs and alcohol during treatment. And when we receive a critical alert, we will immediately email or text your clinician about it. And we'll also set up different periods of time when we can alert your clinicians to different types of surveys. Maybe they want to get a notification at 6 p.m. or first thing in the morning, what have you. So let's say that we want to see how a particular patient is doing. So we'll click on Angela's name, and we'll be brought to a dashboard where we see all the different issues that we are monitoring Angela for. When we start with Insight, as I mentioned before, we will screen patients for a variety of different common co-occurring disorders. And any screening questions that they answer positively, we will then take them to a full academically validated scale for that issue. So for Angela, you can see one of the things we're monitoring her for is depression. And the black bar on the left tells you how Angela reported feeling in the 30 days before she began treatment. So Angela says that she came into treatment feeling severely depressed. She's been doing a lot better with the severity of her depression symptoms until just recently. Something has caused that to climb. We're also monitoring her for anxiety and trauma. She came in having intended to commit suicide. She's been feeling much better since she was in treatment. Again, something has just spiked there. She had a history of self-harm, but she has not been self-harming since she was in treatment. And she has some sort of eating disorder issue. If she was exhibiting the classic symptoms of anorexia, bulimia, or binge eating disorder, it would be in the title. So we're not sure exactly what's going on here. Maybe we'd make a mental note to dig into this further. She says she has not been using drugs or alcohol during treatment. It looks like her cravings have been under control, again, until just now. She's been getting along well with her family members. And for patients in IOP treatment, we always ask how many days a week they're attending treatment. And then finally, we always ask how satisfied are they with treatment. And at several different points in the survey, for example, right after asking how satisfied are they with treatment, we'll ask an open-ended question. In this case, we'll ask why. And most of your patients probably won't bother to respond. But for those that do, what we hear from our clinical users is they feel they often get a different type of information than they do in face-to-face interviews. That some patients are just a lot more comfortable talking to the anonymous internet than they are face-to-face. And so they find that oftentimes these can be very informative. So a couple of other things I'll show you. If you want to generate a report of this, you would just click Generate PDF, and then a report would open up that you could download or print out. You can also see exactly how your patients answered every question. So let's say we want to look at Angela's most recent survey. We would scroll down and we could see every question that she was asked. If you remember, her PHQ-9 score had gone up quite a bit, so we can actually look at the specific questions and see why that happened. We tend to find this most useful in the eating disorder section, because this will tell us exactly what sort of behavior the patient is exhibiting. So if you remember, Angela had some sort of eating disorder issue going on, but she's not making herself vomit. She's not using laxatives or diuretics. She's not engaging in more intense exercise. She is doing a little bit of fasting, and she's doing a little bit of night eating, but she's not apparently binge eating. So what exactly is the reason that she had a higher eating disorder score? And it seems to be particularly because she reported being extremely concerned about feeling fat or being afraid she would gain weight, or maybe having other people judge her based on her weight. So in this case, her eating disorder score seems to be more with how she's feeling versus any eating disorder behaviors. Another thing I'll point out here is that the questions that we ask vary based upon how they answer previous questions. So if Angela had said that there were times that she ate what other people would regard as an unusually large amount of food, she would have been asked the next question, which was, when this happened, did she lose control? And how often, how many times a week during this period did this happen? So what we report on here is just the questions that they were asked. Now, if you're running a larger treatment program, you probably don't want to look through dozens of these individual reports each week. So we also report the results in a different way, in group summary fashion. What you can see here is all the different patients of Jane that are being monitored for depression, and you can see the most recent data point for each of them as a function for how long they've been in treatment. What we do is we label any patients that are in the yellow or red danger zone. So you can scroll down here and you can look at the names that appear over and over again, and you can see which patients seem to be really struggling. We recommend that the clinical director do this before their clinical staff meetings and maybe come prepared to say, hey, what's going on with Angela and Karen? Because they seem to be really struggling. You can see these summaries by clinician or by program. So one last question we often get asked is, how do you enroll patients in the software? So if you have a new patient that comes in, what we recommend is you open up the software on an iPad or a laptop. When you click on New Adult Client, you'll be logged out of this software, and the patient will be taken directly to a permission survey where they give us permission to collect their information and immediately report everything back to your treatment center. Then once they give their permission, and if you serve adolescents, we'll also ask for a parent's permission, then they'll be taken to the intake questionnaire where we screen them for different disorders. We take them to the full academically validated scales for any issues that they have. We get the background information on primary drug of choice and addiction severity and how much they were using, and we also ask different quality of life measures. So once they've submitted that intake survey, that information is brought immediately into the software and is available for your clinician to see it in real time. And what you can see here is whether they have taken the next step. So the intake tells us how they were feeling before they started treatment. Now we want to know, how are they feeling now? And so it looks like George has taken an intake survey but hasn't submitted any progress monitoring updates. So if we wanted him to tell us how he's feeling now and he's in residential treatment, again, we would just click on his name and hand the iPad to him, and he'd be taken directly to the survey. However, if he's in outpatient treatment or has access to the internet or a smartphone, all you have to do is click Make Request, and he will be emailed or texted a link to his next survey. And in fact, what we typically do for our IOP clients is we will automatically send these requests out once a week at whatever time they choose. Oftentimes this is Sunday afternoons, so that when their clinicians come in Monday morning, they have up-to-date information on a lot of their patients. You can always see when the last time a client had submitted a progress monitoring update and when the next one is due. So this is the Insight software, and I'll be happy to answer any questions about this after we finish the rest of the presentation.
Okay, hopefully that was easy to understand how our software works. As I mentioned before, we've taken it the next step to make sure that our clients find it very easy to comply with the Joint Commission accreditation requirements. And by the way, I was at a conference a month ago where Michael Johnson from CARF also spoke about the importance of progress monitoring and indicated that they're anticipating coming out with some sort of requirement for progress monitoring for CARF accredited organizations themselves, maybe in the next year or so. So the first thing we added to our program was we now provide our clients with quarterly audits. And what we're looking for here is Insight being implemented effectively? So we will summarize what percentage of your patients that are on your census were actually enrolled in Insight, and then how frequently were update reports received for these patients. And then finally, how often is each clinician logging in to access the reports? Because if the clinicians are never looking at them, it's going to be hard-pressed to convince your surveyor that these results are actually being used to inform clinical care. The other thing we now provide is a very comprehensive annual report. This ends up being about 20 pages full of very interesting aggregated results on your clients. So one of the things we look at is, of course, demographics. We can show you what percentage of your patients have had different numbers of substance use disorder treatments. We also look at the incidence of co-occurring disorders, both at admission and then prior to discharge. So what you can see here is that 68% of the patients coming into treatment reported having moderate to severe levels of depression, but prior to discharge, this had dropped to 20%. We'll also look at what percentage are successfully completing treatment and how does this compare to national norms. So you can see in this particular case, this IOP program had 47% of their patients successfully completing treatment, which was substantially higher than the national average for IOP programs of only 33%. We also look at, are there areas for improvement? And how do we help you measure them? So perhaps last year, your team decided that you wanted to focus on helping your patients reduce the level of their PTSD symptoms prior to discharge. So we can show you year to year that while the percentage of patients reporting PTSD symptoms at intake really didn't change very much, that this dropped dramatically between last year and this year, and your patients, your clinicians were successful improving treatment. So obviously, not only is this information useful for you for setting goals for your clinicians and your treatment team, But this can also be useful for showing the insurance companies that you are affecting the patient's emotional health. We also look at satisfaction with treatment. And finally, we provide different sample comments, a couple of pages of sample comments. So one of the things that we have heard from a lot of our companies that have recently started using Insight is that they're very interested in receiving this annual report, but they don't really want to wait a full year to get the results, that if they have some areas they want to improve, they want to know sooner rather than later, so they can actually be working on it. So we just announced last week that we're going to be holding the 2018 Outcomes Summit in June 21st through 22nd. And this will be by invitation only to our clients. All of the centers who attend will receive a preliminary report of their program's results to date. And then the majority of the conference will be spent in facilitated conversations. We'll be able to point out that Treatment Center A had particularly low levels of people leaving AMA. So what are they doing differently? And then we'll have some brainstorming and group discussions. We can ask one another. Maybe Treatment Center B is particularly good at helping people reduce the severity of their suicidal thoughts. So what are they doing there? So hopefully this is just going to be a tremendous opportunity for people to understand how their results look for their own treatment center and brainstorm with other addiction treatment thought leaders about how they can improve that. So the only requirement is that our clients have at least 2 months worth of results by June 21st so that they have enough data that it's reasonably predictive. So that is Insight Addiction. And now I'm going to talk about Recovery 2020, which is where we follow up with the patients 1 month, 6 months, and 12 months after leaving treatment. And what we're looking for here is to see, have they been able to stay clean and sober? Or in behavioral, how are they feeling overall? Or if they've relapsed, have they been able to get back into sobriety? We know what different mental disorders they were struggling with during treatment, so we can see how they're doing there also. And then we're looking at what impact did treatment have on different quality of life measures. For example, were they bouncing sofa to sofa before and now they have their own apartment? Are they back working or back in school? Have they been able to avoid any more run-ins with the criminal justice system? And overall, how are they feeling? So one thing that's different about Recovery 2020 versus Insight Addiction or Insight Behavioral is that whereas with Insight, we promise that everything your patients tell us will be immediately reported back to your clinicians so they can use it to inform treatment, Recovery 2020 happens after they leave treatment. And what we do is we promise the patients confidentiality, so that if they know that their counselor would be devastated to learn that they're back shooting heroin, they know that they can tell us this information and it won't get reported back to their clinician except in aggregated form. And the only exception to that is at the end of each survey, if they report that they're using or feeling awful, we'll ask, would you like someone from your treatment center to get back in touch with you to possibly consider going back into treatment? And if they answer that question yes, then we'll immediately let the treatment center know. So it's very important then that we be able to give this data back to you in very useful fashions. So the report that we provide has a lot of different information, a lot of it designed to be able to show your payers how effective your treatment program is. So for addiction treatment, this is probably the most important data. What percentage of your patients were abstinent for at least the last 30 days at 1 year post-treatment? and what percentage were abstinent all year. For the first time, you can show your payers exactly what percentage of your patients are sober 1 year post-treatment. But we know so much more about your patients. So we can show them that, for example, maybe 77% of your patients were reporting being severely depressed at intake. And by the time they discharged, that had been dropped to 25%. But really nicely, it stayed very low for the next year post-treatment. So you can show the payers that not only are you helping these patients with their addiction issue, but they're also far more emotionally healthy. We can show different pre to post treatment information about where they're living and whether they're employed or back in school. So here you can see that before treatment, 2/3 of the patients were working or were students, and now a year post-treatment, it's closer to 90%. And then we also put together some different information specifically for the payers to help them understand that what they paid you for treatment was more than compensated by reductions in what it probably cost them to treat the patients for other conditions in the post-treatment year. So we'll be able to show you the reduction in the number of ER visits in the 1 year post-treatment compared to the 1 year before they started treatment, or the number of unplanned hospital stays, or detox treatments, or residential or PHP treatments. So this type of information can be very useful as you're making your case to payers. But because our mission is to help the entire industry improve, and specifically to help each client improve, we will take it the extra mile and really dig further into your data to try and identify what you're doing particularly well and maybe some different potential areas for improvement. So we will report information maybe after a couple of years for different programs. You'll be able to see that your success rates have been improving for each of the programs. And we, of course, always compare to national benchmarks. And what you could see here is, in this case, the men's program is not quite as effective as the females program. Well, we can dig in further. Maybe we look at the different counselors and discover that 3 out of 4 of the counselors in the men's program had similar success rates. But the 4th one, Jeremy, oh dear, his success rates weren't as good. And here are some of the comments that we heard about Jeremy through the research. Or perhaps we can see that you're doing well treating a variety of different patients, but one exception is those that are struggling with high levels of PTSD symptoms. And maybe you'll want to beef up a trauma-informed care program or what have you. So what we do here is we really try and identify what makes you unique and what are some opportunities that your treatment program could continue to improve. So we really think this type of research has the potential to revolutionize addiction treatment, and we're very excited to see our base of clients continuing to grow. So one question you probably have is, how much does this cost? And what we base our pricing on, this is for insight only, for the during treatment part, is we base it on how many patients do you typically treat at one time. So we'll ask you, what is the maximum number of patients that you typically have in treatment, and we'll give you a monthly cost of somewhere between $10 and $15 per patient per month. And the price, of course, goes down with the larger treatment programs. So let's say you have a mid-sized treatment program. Maybe you're monitoring 60 patients, you're treating 60 patients at a time. Then the cost per month would be $900 per month for Insight. And what you get there is you get free unlimited training sessions, you get the online patient screening and monitoring, You receive the real-time graphing of the results for your patients. You get clinician alerts of new reports. You get the ability to email or text requests to your patients. We offer live phone and email support, typically 7 days a week, typically from 8 in the morning until 8 at night. We have quarterly audit reports. You get the comprehensive annual summary report, and you get an invitation to the Outcome Summit. So for larger treatment centers, if you have over 100 patients, the price will drop to $12 per patient per month. If you have less than between 100 and 500, and then above that, it can drop even further. And for the smallest treatment programs, the price is $299 per month. Now, Recovery 2020, because we are following up with the patients directly, costs a bit more. It costs $100 per patient for the post-treatment year, and basically it's $33.33 for each time that we try and reach out to your patient. So it's $33.33 at 1 month, at 6 months, and at 12 months. And for larger treatment programs that might have 500 or 1,000 patients a year leaving treatment, we can randomly select 250 patients and thus cap the costs at $25,000 apiece. And the only additional cost is that in order to incentivize our researchers, we will charge a incentive bonus if we're able to reach at least 60% of the scheduled patients that we plan to reach in any given month. So our researchers will make 10 to 15 attempts to reach out each time. And we also pay the patients a little bit to take the surveys. We'll give them a Target or a Starbucks gift card worth between $5 and $15. And we also give them a little bit higher incentive if they respond to the first time we reach them each time, if they respond within the next 24 hours. So we are pretty consistently able to reach a little over 60% of the patients. And that's really important because, of course, if you can't reach a high percentage of your patients, then we can't provide you with strong outcomes results. So I'm very excited to announce a new initiative that we have just begun that we're calling the VISTA Research Network. And we wanted to work with a group of the top billing experts in the country to help our mutual clients figure out what's the best way to use this type of information to work with the payers and help the treatment centers that are providing really good treatment results, help them get paid better based on their results, and prepare for value-based reimbursements, which we know are coming down the road. So I'm not sure exactly where we're going to net out. This is a work in progress, but we have several top billing companies that are excited to work with us to help their clients use this data to earn higher reimbursements. And my hope is that over the next 6 months to a year, that we're going to be able to negotiate agreements with different payers, that programs that hit specific benchmarks for Insight and or Recovery 2020 will be able to perhaps be offered in network status or receive higher reimbursement rates or possibly earn pay for performance bonuses or what have you. So this is happening as we speak, and we will have more to report on it later. But billing companies are very interested in working with us because they see the potential to use this type of data, which has never been available before, to negotiate higher payment with the different payers based on how effective treatment center programs are in helping people treat addiction and reducing the severity of emotional health issues. So if you're interested in starting to use Insight, you could just go to start-outcomes.com, fill in a little bit of information about your treatment program, and we would send you an agreement that includes a business associates agreement. And once we get the signed agreement, we can usually get you started using Insight within 24 hours. We just need a little information about all of the different clinicians that would need to be accessing the data in Insight, as well as your program managers. And so we can usually get Insight ready for your use within 24 hours or less. Oftentimes, the thing that takes the longest is for a treatment center to find a time that they can get their staff together to schedule a training session. And our Director of Clinical Services, Stacy Daniel Summers, will hold these training sessions with the staff and explain the rationale behind progress monitoring how to use the software, and answer any questions that come up. And Stacy is a licensed clinical social worker, so she understands where your clinicians are coming from. So if you're not ready to start, but you just have some questions, you'd like to know some bit more about Insight or Recovery 2020, please call our 800 line number and speak to one of our friendly research experts. It's 833-4-OUTCOMES. And finally, just a reminder, if you're interested in attending the Outcomes Summit, we must have you signed up and starting to use Insight with your patients by April 16th. So that concludes the slides and presentation. So I would be happy to answer
Joanna,
any
I did
questions
DM you some questions that had come up throughout the presentation. So if you go to that tab, there are some that had been asked during it. But yes, if anyone has any final questions, feel free to put them in the chat now.
Okay. Well, one question that was asked is, what is the correlation between using this system and receiving improved insurance reimbursements? And basically, it's the reporting that we are able to do either from Insight or from Recovery 2020 that you can provide to the payers to show them just how effective your treatment program is. You know, if you sign up solely for Insight, then you would be focusing on treatment completion rates and the reduction in severity of different co-occurring disorders during the time they were in treatment. I think that payers will be most receptive to treatment programs that come to them with Recovery 2020 outcomes data, where they're able to show what impact that had on actual costs, you know, on different expensive medical interventions that the patients had in the post-treatment year versus the pre-treatment year. So, and also, as I said, we're working with different billing experts to figure out what is the most effective pilot programs and otherwise that we can negotiate with different payers, and hopefully can eventually benefit a wide range of treatment centers. Another question we were asked is, gosh, we know that patients are often dishonest, and can we really rely on their self-report? Because sometimes they're just in denial and we may not get honest answers. And I can say that we certainly have seen a little of this. Not that much, frankly. Most people, when they come into treatment, will report feeling very severe levels of anxiety and trauma and suicidality, often depression, and then, of course, about a third of the patients will report some pretty severe eating disorders. So that not reporting, you know, being in denial about their issues is not a typical problem. However, we have seen it And more so, I think, with patients that are required to attend treatment, maybe a drug court or something else, an employer required that they go into treatment. What we see sometimes is patients reporting, I was drinking 25 drinks a day before I came into treatment, and, I had a DUI, and I had this, and I had that, but, I'm doing great. I'm not depressed. I'm not anxious. I'm not traumatized. I'm not anything. I'm doing great. And so if they answer all of our screening questions negatively, then of course we're not getting a lot of information about, actually how they're feeling in terms of depression, anxiety, or eating disorders or trauma, that sort of thing. We always do ask a suicide question regardless, and we always ask about cravings and satisfaction with treatment. But because we did have some situations where clinicians, once they started to work with a patient, said, he may have said he didn't have any anxiety, but I really believe that he is dealing with that. And so we have allowed clinicians to modify what co-occurring disorders are asked in the surveys for a particular patient. So if a clinician says, I really think we need to start monitoring Jane for anxiety, she can just go into Jane's edit page and say that from this point on, she wants Jane asked about anxiety and taken to the GAD-7 scale. So it's a matter of 10 seconds to make that change. So I don't know if there are any other questions. We often get asked if we are integrating with different EHRs, and we are happy to integrate with different EHRs. We're moving forward with several of them, and other ones we're still in the discussion phase. But if you have an EHR and you would like to be able to have the reports automatically brought into the appropriate patient record, we're more than happy to do that. So let's see, are there any other questions? Let me look.
Final call? It doesn't look like anyone is typing currently, but I'll give it a couple more minutes just to make sure, or a couple more seconds. Okay, it looks like that.
There is different. Okay, there are different pieces of information we'd be happy to provide you if it would be helpful. If you go on our website, which is vista-research-group.com, you can download a summary page that shows the type of data that you received from both Insight and Recovery 2020. There's also an ebook for both addiction treatment and an ebook for behavioral health care. There's some case studies and stuff. Please feel free to download anything. And if you would like to set up a demo for any of your top management or your clinical team, there's a link on the front page where you can schedule a demo. So anyway, we're really excited about your interest in the program and really look forward to working with you. So thank you so much for coming on the webinar. And again, thank you so much to the American Addiction Treatment Association, aka the Behavioral Health Care Association of Providers. So thank you.
I want to thank Joanna Conti for presenting today. Thanks as well for everyone in our audience for participating. A reminder that a PDF of this slideshow, along with a link to the presentation video, will be sent out by email in the next day or so. We hope that you join us for future BAJP webinars. This concludes today's webinar. Thank you very much.